everyone, how are you all doing? So today's video is going to focus on active ingredients. We discussed in the last video that we did with Q Skin how we get pigmentation and what are the triggers that are causing pigmentation formation, and then we went through the different stages of pigment forming. And what I wanted to do today was focus on key ingredients that we can use to help focus on either inhibiting the production of melanin or acting as preventative ingredients to kind of stop the signaling of pigment formation. So we're going to go through a few ingredients. Of course, on the Q Skin platform, there's also other posts that help give you a bit of insight into ingredients that we can use to treat specific skin conditions. And if you ever get stuck, you're welcome to just send me a message. I'm always there to help you navigate through your skincare products and treatments and concerns. So we're going to look at ingredients like retinol and a few of the derivatives from the retinoid family. We're going to look at ingredients like kojic acid, arbutin, tranexamic acid, licorice extract. So to kick off, let's just start with retinol, as it's something that we've been discussing recently. Now there's a whole retinoid family, and there's different derivatives of retinol, which is actually vitamin A. And what let's just talk about it as a family as a whole, and essentially what vitamin A does on the skin as a topical application. It is a cell communicating ingredient. So it is really getting activity going within the skin. And the highlight of this ingredient is cell normalizing. So essentially its goal as an ingredient is to get the skin functioning optimally again. So the way I like to think about how it works is you apply vitamin A onto the skin, and it'll go into the skin and moves its way down through the different layers of the epidermis. And then what it does is it identifies skin cells that are not looking so normal and probably malfunctioning or aging, whatever characteristic it would have, identifying as a skin concern. And this vitamin A, in whatever shape or form it is going to go to the skin cell and say, hey buddy, you're not looking too good. How about you come on a little journey with me and we go to the top of the skin? And that's when it will start cell renewing the skin and, turning over those skin cells, so exfoliating that skin. Or what it can do is identify skin cells that are abnormal or not acting normal, and it'll say to the skin cell, I wonder if I can help you. And maybe it'll start a bit of a repair process or rejuvenating process and help to start fix or rehabilitate that skin cell. So that's just a really fun way of identifying what vitamin A does. So cell normalizing, it either is going to try repair and fix that skin cell, or it's going to be like, you too far gone, Mr. Skin Cell, you're so damaged, I'm going to have to cell turn over you and take you to the top of the epidermis and discriminate you off. So those are the kind of focuses that vitamin A does, and whatever derivative or strength it's doing will determine on how effective that retinol, retinoic acid, tretinoin, HPR is going to be on the skin. And yeah, if you have any questions about your specific retinols, please let me know. I'll happily answer those for you. So the next ingredient we can look at is your tranexamic acid. Now this is a natural plant extract, and basically this product, so if you look at a trigger that melanin is being formed, the main trigger that we always look at is UV exposure. So tranexamic acid is actually inhibiting that UV-induced melanogenesis process. as well as tranexamic acid, is a really good anti-inflammatory. And we discussed in the previous video that pigmentation and the melanocyte, that octopus dendritic cell, is a skin protecting cell. And we said that the immune system has skin protecting cells as well, like the Langerhans cell. And whenever these skin cells are triggered, one is producing pigment and the other one is causing an inflammatory response. So when we say ingredients that are treating pigmentation are also anti-inflammatory, well, it's because they kind of feed off each other. So if we're inflamed, the skin is going to produce pigment. So if your ingredient is controlling inflammation, we're preventing pigmentation. So tranexamic acid, really good for UV-induced pigment forming and also anti-inflammatory. Then our next ingredient that we're going to look at is licorice root extract. Now this guy has two really magic properties, and who would have thought that this skin lightening and potent anti-inflammatory ingredient. So the skin lightening actually is focusing on the UVB induced pigmentation, and of course potent anti-inflammatory, soothing and calming those skin reactions. The next ingredient is phytic acid, and this one has quite a unique role within the prevention of pigment formation. It is a plant-based extract and has brightening ingredients where it helps inhibit the binding of copper. So when tyrosinase activates tyrosine, copper is then added and causes a whole bunch of oxidative reactions forming melanin. So phytic acid actually prevents that copper from binding and in turn prevents melanin from forming. So kojic acid having two benefits: reducing tyrosinase enzyme formation as well as your melanin when the alpha melanin stimulating hormone is present from sun exposure. So those are a few ingredients that we've spoken about, and really the point of looking at targeted active ingredients is looking at the triggers of melanin, so identifying the triggers that are causing the melanogenesis process, and then identifying key ingredients that talk to those triggers that are going to help control or slow down those triggers within the skin. So the next point is, with all these beautiful active ingredients that are available to us and are put into formulations in skincare products to target different triggers at different points of the process of melanin being formed, it is also so important to regularly and daily use your sun protection factor. A high broad spectrum SPF factor is going to be your first line of defense, the first barrier to those triggers that are starting the melanin forming process. So if you have any questions regarding active ingredients or ones that you perhaps stumble across and find that you are curious about, let us know and we can all learn from you. Thanks so much. Have a good day, guys. Bye.